Hello, Dike Drummond from thehappymd.com. With a quick video, I'm going to show you a way I recommend you consider reaching out to a colleague who you suspect might be burnt out. We have to do it in a very specific fashion, otherwise our programming to never show weakness will make it really hard to make the connection you'd like to with your overstressed colleague. Check it out. You know, it's almost sometimes like there's a conspiracy in a healthcare workplace, especially with doctors, right? We have such strong programming that we get through our medical education. There's the classic big four: workaholic, superhero, lone ranger, perfectionist. But there's also the two prime directives. The first one, patient comes first. And the second one is never show weakness. So I know that you know this because you've done it yourself. We all do it. We learn this when we're coming up through our residency training. If anybody were to come up to you at any point in time and ask you, hey, you look tired, are you okay? What are we going to say back to them just like that? Well, that same programming gets in the way when you're trying to reach out to a colleague that you think might be burnt out. Now, I personally think we all have an ethical responsibility to reach out to our colleagues that we think are overstressed and struggling, simply because of the suicide rate amongst doctors. Because doctors, because of this never show weakness programming, sometimes will take their burnout to the grave. And it doesn't have to be that way. So here's how I recommend you reach out to a partner if you think that they're burnt out. Now, the first thing you have to do is make sure that they understand that you're coming to them heart to heart as a real individual human being, not because you're a doctor or a colleague, or heaven forbid you're in some leadership position where you're a medical director. So what I recommend that you do is get a time when it's okay to talk to them. Hey, John, it's Dike. Can we talk for a second? And John's going to say, yeah, sure. Now, what I want to do is make sure that he knows that I want to make a human connection with him. And so what I'm going to do is put my hand on my head. Go ahead and put your hand on your head with me. Put my hand on my head. I'm going to say, I'm taking my doctor hat off now. So do that. I'm taking my doctor hat off now. So that sends you a signal that you're stepping out of that role. It also sends your colleague a signal that this is not them talking to another doctor, especially if you are in an official leadership role. Hey, John, I'm taking my medical director hat off now. Do that before you do anything else. Otherwise, the chance of a connection is dramatically reduced. So, John, I'm taking my doctor hat off now. It's just you and me, heart to heart. I've been watching you and I'm concerned. How are you doing? To which he's going to immediately answer, how? Yeah, fine. That's okay. Is that him or his programming? Well, I'm going to tell you it's most likely his programming. But the key here is he doesn't have to break down and cry and admit everything's terrible or whatever. There doesn't have to be anything dramatic here. You're sending a very clear signal though. John, I'm concerned. And if you ever get to the point where you're ready to talk about it, I'm ready to listen. Now, since you're very likely to get intense denial with the first time you reach out, and by the way, you have to expect it. It doesn't mean you've failed, okay? Intense denial is normal almost all the time. I'm going to encourage you to be persistent. Don't make them think they got a target on their back or that you're stalking them, but every once in a while, hey, John, it's Dike, taking my doctor hat off again. How are you doing? You're sending that signal that when you get ready to talk, I'm ready to listen. Now, your odds are best because of the gender biases between men and women being willing to admit that there's an issue. The highest odds of you being able to reach out to somebody and make a connection the first time are if you're a woman reaching out to a good friend who's also a woman. The lowest odds are if you're a man reaching out to somebody who's not a good friend of yours who happens to be another man. But the key is, if you suspect somebody's burned out and struggling, please reach out. Overcome the taboo. Take your doctor hat off. Reach out to them heart to heart and be totally prepared for intense rejection because their programming won't let it be any other way. But do not let that stop you. Be persistent. Come from your heart. Ask them how they're doing. And eventually, if it's right, they may open up to you and you may forge a connection with them that is potentially life-saving. So if you think somebody's in trouble, reach out, take your hat off, and keep it up. Does that make sense? I hope that helps. I think that you'll find this makes a huge difference, and persistence will too. We can, by our efforts of reaching out and trying to take better care of each other, we can actually shift the culture of the workplace. And I encourage you to play your part in doing just that. That's all for now. Keep breathing and have a great rest of your day.